7:49 right now. With back-to-school shopping in high gear, it's also a good time to think about visiting the dentist. Learning and utilizing some good habits will help keep your child's teeth in great shape for the entire school year. Joining me now is Dr. Melvin Pierson with the Pierson Dental Associates in Sicklerville, New Jersey. Thank you for joining us this morning, bright and early.
Thank you for having me.
Appreciate it. Now, there's a lot of questions that comes with kids in dental care. What are some good steps a parent can take to make sure their kids have healthy teeth?
Well, one of the first steps you need to take is understand that tooth decay is a disease. Right now in the 21st century, year 2010, it's the #1 childhood disease. It's 5 times more common than asthma, and the worst thing about it, it's a totally preventable disease. So when the parents understand that, then they can do some things, and I have some props to show what they should do.
You brought some snacks in for us, I see.
I brought some snacks.
Oh, it's like a snack. So these are the good snacks that you want your kids to eat. Why are these different than, say, what's the difference between these snacks?
Well, for example, a lot of kids like to drink sodas. Sodas are not good because they can help accelerate the tooth decay process.
Okay.
I'll recommend with a back to school is drinking water, either buying your own bottled water or purchasing a biodegradable, reusable water bottle.
Better for the environment.
Better for the environment. Raisins, cookies, things like that. Sweets, they taste very good. I eat a lot of them, but raisins are not good for your teeth.
I always put that in the healthy category.
They're a healthy product, but they're not healthy for the teeth. It's healthy for the body, not for the teeth.
Good to know.
What we recommend is something that's crunchy, such as the celery, the carrot sticks, the apples, or fruit, and you want particular fruit that are low in carbohydrate, high in water content.
Okay.
Those are things that are really healthy for the teeth.
Okay, also good, you know, a little snack at school, good for them. Now, parents, the brushing of the teeth, I know I used to, I'm sure a lot of kids out there did, you'd go and just get your toothbrush wet and then bring it back. Let's look, brush my teeth. Besides brushing, what's also important? How do you check? Can you check?
Here's how you check with the kids. You bribe them.
Okay.
You offer the children something they like.
Okay.
In turn for a good report card. It's going back to school, so make the dental report card a part of that school report card. Something like a gift card that they can get what they want if they get a good dental report card will ensure a child of not going in and wet the toothbrush. If you have a sibling and one sibling gets a gift card to go to the store and gets what he or she wants and the other one doesn't, you're now creating an environment of good dental habits.
Very nice.
Also, if the kids play sports, definitely you want to make them a sports guard.
Okay.
Children are 60 times more common to have a tooth injury than an athlete. And a lot of parents are letting their kids play sports without these sports guards.
Okay, and one last important question. Some kids have a little bit of fear going to the dentist. What are good ways for parents to, help them overcome that fear so that they know it's a good place to go and you want to go there?
One of the first things we have to do is educate the parents. Parents can be our best allies. They could also be our greatest enemies. Parents sometimes like to enforce some of the things they had onto the child, but a lot of technology has changed. For example, a lot of parents would recognize this instrument, a very sharp, pointy instrument.
Makes me nervous. Yeah, this one right here.
Cavities.
Remember that? Oof.
Right.
Yeah.
But now we have a laser that detects cavities by scanning pulses of light through the tooth. So it's as gentle as shining a light on your tooth.
I'd take that over the pokey one any day.
And so will the children. So this is some of the technology that we're using to now get children more into the dentist.
Great tips, Dr. Pierson. Thank you very much for joining us this morning.
Thank you for having me.
Appreciate it.
All right.
I'll make sure I skip the raisins next time.